Senate Bill 202, having received a constitutional majority, declared passed. Clerk will read the bill.
Senate Bill 605, relating to nurses.
We recognize Senator Monis Anderson, please.
Thank you, Mr. President. Colleagues, Senate Bill 605 is a good bill. Oregon has been a leader on nurse practitioner and clinical nurse specialist legislation. In 1979, nurse practitioners were given the authority to dispense medications, and current administrative rules, though, say that dispensing requires that the clinical nurse and nurse practitioner personally dispense drugs to the patient. And this was due in part to the Board of Nursing's council opinion that since the law did not specifically address delegation, that it could not be assumed, and therefore this bill came forward. Now, the Medical Practice Act, which governs physicians, it contains the specification that states non-judgmental dispensing functions may be delegated to staff assistants when the accuracy and completeness of the prescription is verified by the physician or physician and surgeon. Apparently, there was concern that since the Nurse Practice Act does not contain that particular sentence that's in the Medical Practice Act, that we needed to add it to statute. The need for nurse practitioners and certified nurse specialists to personally dispense prescriptions really creates difficulties in their clinical practice. Patient visits are often interrupted because the nurse practitioner must leave one patient to hand deliver medication to another patient. The nurse practitioner previously completed the education and verified that the prescription is correct, so delegation practices are not approved. The Oregon Nurses Association Cabinet on Health Policy on behalf of Nurse Practitioners of Oregon and the Clinical Nurse Specialists of Oregon believes that the above stated requirement is inefficient and unnecessary. To mandate that the nurse practitioners or certified nurse specialists personally hand the medication to the patient is not related to patient safety or effectiveness of treatment, as long as other standards of dispensing practice are met. Colleagues, I urge an aye vote on Senate Bill 605.
Thank you, Senator. Discussion on the measure. Question rise upon third reading and final passage. Senate Bill 605. Those opinion bills pass, say aye. Those opposed, no. Clerk, please call the roll.
Boquist. Burdick. Carter. Devlin. Dingfelder. Dingfelder. Ferrioli. Ferrioli.
Senator Ferrioli. Senator Ferrioli.
George. Gerard. Hass. Hass. Johnson. Cruz. Betzger. Monis Anderson. Monroe. Morissette. Morse. Nelson. Brzezinski. Rosenbaum. Schrader. Starr. Telfer. Verger. Walker. Whitsett.
Yes.
Winters. Atkinson. Bates. Bonamici. President Courtney.
Yes.
30 ayes.
The Senate Bill 605, having received the constitutional majority, is declared passed. First reading of House measures.